There you go. Okay, good. There you go. There you go. Now.
I'm alright. A little more neck and then right behind my shoulder blade on the right side.
Go ahead and turn around for me. So kind of right here at the border here.
Yeah, and then this hip feels a little almost like it's jammed.
Real lateral right there on the side. Okay. All right. Yeah, we got what I call a long torso. When you have a long torso, it's like a lever. The longer the lever is, the more torque your lower back takes. You know, it's one of the advantages of being taller, but also, you know, a lot of leverage gets placed in that lower back. All right, bend both the knees for me. There we go. All right, just roll your side a little bit for me. And I'm going to bring you back onto your back here. All right, breathe in deep for me. And then exhale. Let it all go. I got you. Yeah, a little tight in there. I got you. Breathe in deep. Let it go. I got you, Tim. Here we go. There we go. Breathe in deep. Exhale. Let it go. Chin down. All right, good. See you there for me. All right, bottom leg straight. We're going to keep that arch in your lower back. There we go. A little closer to me. All right, going to breathe in. Look over this shoulder as best you can. Exhale. We're going to go real gentle. I got you. All right. Other side for me. Good. Okay. So arch that lower back. Whenever I'm adjusting the lower back, I want to keep this arch, that lumbar lordosis that we talk about a lot, and want that curve in there as much as possible. Breathe in deep for me. And then exhale. I got you. Good. Let's go face that for me. So that right shoulder blade. Okay. Right side of your neck's a little bit out here. All right, we're gonna go real gentle and see how it's moving before we loosen it up. I got you. There you go. Okay, good. I got you. Let this side go right there. I got you. A little tight. I got you. Real gentle. I got you. There you go. Nice. All right. So sometimes, you know, Ed, why sometimes do you adjust me? Or massage me first and then adjust me, and sometimes you just to go for the adjustment before massage. I'm trying to get an idea of how your spine's moving cold. Does that make sense? I want to see how it moves before you've been massaged. It's like somebody might say, you know, Ed, my spine moves much better after a 20-minute massage, and I go, well, it shouldn't require a 20-minute massage to have your bones moving. I want to, you know, get an assessment, does that make sense, of how your back is moving cold. You understand? And then that tells me, you know, how your spine was moving this morning, you know, before you came in here, you know, how much of your back is working. It shouldn't require, you know, a lot of work to get your spine moving the way it's supposed to. Should just move on the first adjustment, no restriction, you know, no difficulty, just, and your upper neck, like I've taught you before, this is supposed to be. What do you have a couple car accidents in your history? What's your?
Yeah, one, and then sports injuries.
Soccer mainly?
Yeah.
How many years did you play soccer?
I don't know, up into college, so.
Okay, all right, pro, okay.
Yeah.
What position?
Midfield.
Midfielder? Okay.
Yeah. Let the mic fix that.
Dang it.
That was from
Oh, okay, she did.
Napoleon, though.
Oh, very good. Dang it.
It's a constant game with me trying to guess the things I'm
Ed's.
referring to.
Yeah. Got like 3 feet ahead that time.
Build her a cake or something. Yeah, a little tight over here. All right. There we go. Yeah, there just should be just an effortlessness. There we go. Perfect. The adjustment is the disparity between where you want to be and where I want you to be. You know, I want your neck to be curved. Most of our lives and work and, you know, injuries take us out of that normal position. Does that make sense? And so the disparity between where you want to be and where I want you to be is the adjustment. And the more we can get your spine to stay in the ideal position, the better you'll feel and less pain. Pain to me is a result of being in the wrong position for too long and then certain areas are getting overpressured as a result of the bad posture, and our world really doesn't have anybody really constantly checking us, and we're just sort of left to, well, walk it off, kid. Walk it off. I mean, how many times have you told that probably when you played soccer, right? Yeah. I think my knee might be busted. Walk it off. You shake it out. Mm-hmm. I'm not sure if that's a medical solution for my problem here. I think I have a torn ACL. Walk it off. Mm-hmm. Okay. All right, there we go. So I'm combing them pretty evenly. I've combed this whole area, and the biggest mark's coming out right down here. And the nerves that leave the lower neck, actually the joint in here, when this joint's inflamed, it refers pain right to the border of the scapula. It's called a joint referral pain. So embryonically, the lower neck and the shoulder blade, the border of the scapula, both came from the same part of what we call the embryonic spinal cord, or the notochord. And so when this area is inflamed, you get pain here. Just give me the cliff notes, Ed. I don't need the whole explanation. All right, well, lower neck hurt, shoulder blade hurt. But this gets inflamed. The neck, the arch in the neck, how much arch is in your neck takes stress off this area. The muscles have to work harder when there's, when you're rooting on your soccer team, or they lose and you no! Bend forward, and life bending forward causes these muscles to be tighter than they're supposed to be. But if you can see all that, that's just, there shouldn't be any mark in there. And if I combed your neck and you had no symptoms in here, I'd go, this is confusing. I don't know what's going on. But this sort of validates my point that this area is causing that shoulder blade pain. And then getting the curve back in your neck helps to prevent the level of buildup. So it stops building up to such a high degree, and you can go longer between adjustments, you do your stretches. But I know you work quite a bit taking care of someone, right? Mm-hmm. That's pretty physically, you're sitting a lot, or you're helping move. It's a lot of, I think with a longer torso, like I said, it's like a wrench. The longer the wrench is, the more torque. Mm-hmm. So the length of the torso, it's like a lever. So, my lady the other day, she was complaining about being short-waisted, and I was like, okay, well, but there's less torque on your lower back. Wish her torso was longer, but not necessarily the worst thing. All right. So when I look at your back, Tim, right now, this right side is more lifted up. If I put a marble on your back, it's going to roll off to your left. And you were saying there's that right hip that's hurting, sort of, this right side will feed down to that right hip. So we want to get this level. If this is uneven, then the hips get worked unevenly. So leveling this out will help that lower back. And even when I'm working on you right now, I got this pelvic piece lifted. That's to help get some arch and some sway in your lower back. So whenever I'm working on a patient, does that make sense, Tim? I want you in the position that I want you to be in, in the long term. Mm-hmm. This is why I think massage sitting is a little silly. Because you're sitting, it's like, when I was a kid, my dad would have his patients sitting in the waiting room, waiting to get worked on, and he'd be working on another patient, and then he'd call the patient in, and then of course tell them about how bad sitting was for their back, right? But they just sat for a half hour before, so it was like a little odd. So it's why my office now is set up. You come in, you lay down, as soon as you can. The abundance of sitting is a big reason for why the lower back gets overexerted, that loss of curve, and so a little hypocrisy immediately. Yeah, come on in and sit down in this waiting room. I learned at a young age that most women had candy and gum in their purse, so I'd be like 3 or 4 years old, walking around my dad's office. Got candy, got gum? Got candy, got gum? This side's not too bad. You can see this is softer over here. We're gonna get to that monster. Yeah, right there. Yeah. Whew. It feels like a blockade right there, Tim. Mm-hmm. So the rest of your life daily, you have to I know the symptoms were, right hip and, right shoulder blade, but it's really this in-between spot that's, where the biggest restriction is, and then the areas above and below are just compensating. So every day we got to get on our back and press into this area, keep it loose. And then if it's so tight, Ed, I really don't care to do that. I don't look forward to getting on a stretch. And so obviously we use the visits as a way of encouraging this area to stay supple and loose, so it's not the end of the world to get on your back and stretch, and you can more easily do it. But yeah, it's just, all right, here we go. Breathe, Tim, breathe. All right. Bring this arm back behind your back for me. Put it right here for a second. There we go. There we go.
Yeah, it feels like gravel.
Almost done. All right. Gotcha. All right. Yeah, we gotta just break loose all the glue in here. Yeah, lovely, Ed.
Mm-hmm.
Should I charge more for this real estate? This is like long. I'm going to make the journey down to your middle back. It's a long torso. Yeah, right there. Probably some collisions in here from soccer. I can't remember. My wife told me when I first started dating her, I said, how many times have you fallen off that horse? She's like, I can't count. How many soccer injuries have you had? No, I don't think I can count. They sort of all run together, Ed. Right there, yeah. Unglue the scapula. Okay, all right. Yeah, I think about how often in an average person's day do we take a real deep breath in, right? Full inhalation. And so this area, the top of our lungs is opening and shutting a lot, but the bottom, like these ribs, you understand, every time you take a real deep breath in, they separate, and then you exhale and they close. But because we don't really take too often a really deep breath in, this area becomes sort of glued more so than the upper. Right here on the side, this is just, I know them. Gotcha, Tim. Go. When we first started out on you, Tim, it was like came out everywhere, really dark. I mean, there's some today because of this acting up, but even this, I know this is, I would consider this mild or milder than it was when we started. But anyway, I want to try to come over here. Some stuff. If I'm going too hard, Tim, just let me know, okay? All right. Right here. Oh, that's darker than that. These are the stabilization muscles to your hip, and so sitting for too long sort of shortens these muscles. You know, if you're standing, not moving for a very long period, like if you're just standing, like legs contracted, this area will, you know, movement keeps it loose, but being static, you know, locks down this area. They're stabilization muscles. Right there, yeah, that's that feeds the hip, right in there. Why isn't it not self-cleaning? Well, it's the circulation sort of lost its ability to push blood into high-pressure regions. You know, Ed, I watched how many hours of soccer this morning? Wasn't really necessary for there much mobility in here. And it almost directly correlates with the pain. You know, when there's that much acidity in there, the patient will, you know, and it's right in here. You know, this is where it's hurting. We gotta get this area cleaned out and then try to help put you in a good position where it won't build up so quickly, and then that's what I call healthcare.
Going from, you know, my back going out once every 4 months to, you know, now not at all is.
Isn't that cool?
Yeah.
You're so much farther away from, you know, increasing stability of your spine. My dad sort of didn't find that until he found the stretching. You know, it was, people did everything he would tell them, but then their back would easily go out, and it wasn't until we found that we have to change the posture, you know, and that adds a lasting stability. But before 1997, they really were only teaching that adjustments change posture, that a skilled chiropractic adjustment changes the posture, and then enough research to come out to show that it requires stretching. Stretching is how your posture is made worse. Stretching is how it's fixed, or undone, untangled. It's actually about stretching the front part of your body. Really, the back has been stretched out all the time because we're hunched forward, and the front has been collapsed. Does that make sense? And so it's about opening up the front. I know we pay so much attention to the to the back part because we can't really access the anterior longitudinal ligament. There's a rubber band that runs from the front part of your skull down to your pubic bone, and that ligament's never been stretched. And so that's really what we're trying to do is get the structures on the back part of your spine to be able to fold together so that you can actually get deep enough to stretch that anterior rubber band.
Well, I used to just stretch bending forward.
Oh.
Like.
Were you given those stretches, or you just sort of instinctively sort of went that way, or?
It was just ones we did for sports that I kind of just thought, well,
right.
My legs are tight.
Right.
Feels good when you bend forward.
Right. Gotcha. I gotcha. Yeah, it's like being a nutritionist, just basing your diet off of foods that taste good.
Mm-hmm.
And the way nerves work is that you can be just sub-threshold. Like, Ed, my left hip wasn't hurting today. It was just my right hip. So why is all this lactic acid on my left hip? Well, you might be a couple millimeters from pain. Does that make sense?
Mm-hmm.
So pain finally arrives as sort of the last thing. And this buildup happens way before. It's like a cavity of tooth. The cavity's been forming way before you finally felt the tooth, right? Before the nerve root in the tooth was finally hit. Very good. What's this scar from? Never looks so recent. What happened?
Skateboarding.
You're what?
Yeah.
You a skate park, or what? You just
No.
just around?
Yeah. Neighbors' kids. I had to show off.
Oh.
Yeah.
Watch this.
Yeah, watch this.
Watch this. You doing like a kickflip or something? Trying some tricks or what?
Trying to.
Trying.
Yeah.
How does this feel? Let's breathe.
Yeah, it's all built up there.
Yeah. And it feels bad in a good way.
Mm-hmm.
Or it hurts in a good way.
Get some blood in there to speed this up. Right there.
Can you tell which arm is dominant?
Left one, is it left one?
Mm-hmm.
Yeah, I know. How bigger that is right there, yeah, gee whiz. I mean, it's not like Rafael Nadal,
Yeah.
You could just stand 30 feet away from him and go, left arm dominant. Not the posterior deltoid head anywhere but there. I could just see it tight. I didn't even touch it. I could see it was like just.
I didn't realize until you said.
Right. He's not letting it go. Usually your body guards things. It's like, Ed, something happened a while ago, and right there, he's hiding an injury. See how quickly that comes out. You can see based on how I got you. How quickly that comes out tells you how much is in there.
Well, this would be the front arm that would catch the fall first, usually. Oh man. Yeah. That's not as bad as it has been. That's for sure.
Yeah.
Feels much better already.
Excellent. I got you. Breathe. Let this sink in a little bit. You okay?
Mm-hmm.
All right, breathe. Let it relax for a second. There you go. Good. Just gotta come up a little bit. Good. I got you. Good. You okay?
Mm-hmm.
Keep breathing. Good. I got you, bud. There you go. Nice. Good. Okay. Excellent. Yeah, I know it's a tough one when the torso's that long. Here. There we go. Good. Nice. Much smoother, much more level. There we go. All right. Check these glutes a little bit. Not the butt. I'm ticklish there. You never said anything about. Okay. You've jammed these. Wow. What have you done to that toe?
I don't know.
That's normal. 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 And then this second toe, oh my goodness. Alright, hold on to the table like near your head, sort of above your head. Hold on to it, yeah. That's what hold. I'm gonna pull you this way so you can hold. I got your leg, I got you, bud. There you go, good, nice. Gotcha. Nice, nice. There we go, got your leg. Hold on as best you can. I got you. There we go. There we go, good, okay. Just gonna try to traction, open your knee a little bit here. I got your leg. I got your leg. I got you. There you go. Nice, there we go. There we go. Nice, there we go. Put your hand on your hip for me. So you put your hand there and you're gonna hold on there, and then I'm gonna have you press back. Give me 1 second, just sort of press back into my elbow. Press back hard, a little bit harder. Hold on, press back a little bit. That's okay. I'm just checking. Put your hand on your hip. There we go. There we go. All right, now press sort of back there. There we go. There we go, a little bit. All right. There we go. All right. Go ahead and tilt your head to the left a little bit for me. Tilt your head left. There we go. There we go. Good. I got you. Tilt your head to the left a little bit for me. Good.
Your hearing just improved tenfold. No, I'm just kidding.
It's all about the grip. You gotta get a good grip of that. There we go. All right, go ahead and tilt your head to the right a little bit. There we go. Good. There we go. And tilt your head to the right a little bit. All right, good.
I did. I can feel that. Like, yeah.
Perfect. Look at that. Oh, that's about what we're looking for. See how the seam on his shirt lines up with his ear hole? That's what you want. That's where I'm at. So even laying face down on my table, Tim, it holds you upright. Does that make sense? So it's almost like a stretch. Even just laying face down, because I have the pelvic piece up and I have you arched back. Just laying on my table, just being in my office, you're already stretching back. Does that make sense? Because the table doesn't allow you to go forward, so it holds you there, and then I work on you, and then when you come up, your body's going to be like, okay, I guess this is where home is now, and this is a position that'll last another 70 years.
Yeah.